Tomorrow we mark World AIDS Day to fight the illness as well as the stigma surrounding it. We talk about this and HIV care in the country with infectious diseases specialist Doctor Karl Evans Henson, joining us from Australia, and HIV advocate Lorenz Olleres. Hello, good evening to you both, and welcome to The Final Word.
Hi, Mai. Good evening. Thank you for having me.
Let's start with you, Dr. Karl. Now, UNICEF has just warned before World AIDS Day that progress in HIV prevention and treatment has nearly flatlined over the past 3 years, and this is affecting 2.7 million youth. I'd like to get your thoughts on this because it also says many regions are still not at pre-pandemic service coverage.
Well, that's true. The Philippines, as you probably have heard, has the fastest growing epidemic in the world. And that's both good and bad in the sense that we're picking up more cases and putting them on treatment. But then a lot of people are getting sick or are diagnosed sick. And during the pandemic, there really was a suspension or a slowing down of services. The treatment hubs were able to rise to the occasion. They shipped the medicines, etc. But the testing was the problem. People stopped getting tested, so we weren't really able to pick up the usual number of cases that we are expected to pick up. So I think we have a lot of catching up to do.
Mm-hmm. Well, Doctor, I know one of the things that advocates have been pushing for is to address the inequalities which are holding back progress in ending AIDS. And some may say there's been progress in certain fronts, but then, as you mentioned, the pandemic happened, and this pandemic has affected each and every one of us. Now, so this pandemic has, like you said, slowed down everything, like I would guess the services also for those with HIV and those seeking diagnosis.
Yes, that's correct. And I think one of the things that we need to address also that's hampering the overall HIV/AIDS response is the stigma, And that's something that I think, will address with Freddy Gomez in 1 or 2 days at Med Talk Health Talk. We did talk about the role of stigma and how people don't get tested and don't get the necessary services and treatment required because there is such a lot of fear when going to the social health clinic or getting tested and availing treatment.
Mm-hmm. Well, you mentioned that in the Philippines, this is the fastest growing epidemic in the world, and that's quite alarming. Now, how would you suggest that we address this?
Well, HIV affects a relatively small segment of the population. The high-risk groups, men who have sex with men, transgender women who have sex with men, these are really the most at-risk groups. But you don't only take a look at them, you also take a look at the impact on their families, etc. So we say that it's the fastest growing. So even if it only involves a very small segment of the population, the rate of increase in cases is what's alarming. We're really seeing a lot more cases these days, whereas in the rest of the world, it's really going down. So the government and NGOs, private groups really have to be focused on getting these high-risk groups, get them more knowledge, really feed them more correct information, tell them that there's treatment, tell them about the government services, etc. Mm-hmm. I think it's important. So there's one survey that says among, say, 5,000 people of at-risk groups, only a third know that there's treatment for HIV. So that's a really alarming number, I think.
Mm-hmm. So I'd like to talk to Lorenz now. What is the situation really among the community with HIV? Do they know they have access to testing and treatment? And how much access is there?
Actually, accessibility of the healthcare, I mean, the treatment here in the Philippines is all free. So it is given by the government free, and at the same time, for all of the person living with HIV, we just have a minimal problem in terms of care in the provinces, not in the metro, because some of the machineries in like the viral load treatment in the provinces, it takes time for them to get the viral load. At the same time, since it's secluded in the main or where do they get the antiretroviral, sometimes it takes time for them to deliver the medication. So the most common problem as of the moment, even though it's free, is the delivery or delivery assistance and the machineries in the provinces.
Well, Lorenz, we are now in the new normal, and we have been dealing with and living with COVID-19 for almost 2 years now. How are people with HIV taking care of their health in this new normal?
We are just like normal fit people, to be honest. What we do is also take care of our mental health. Mental health is really important for a person living with HIV, because sometimes when they tend to communicate with other people and try to open up themselves, sometimes there is still stigma or discrimination in such a way where if they didn't got that certain kind of acceptance, it will trigger their mental health point. Um, at the same time, we keep on taking our antiretrovirals, always go for our anniversary laboratories, and keeping ourselves positive even though we're positive.
And Lawrence, we know support groups are very important too, right? And for anyone who is struggling with something. So how do people with HIV stay connected with each other, and are they able to meet now as a community?
So there is informal and formal support groups. The informal support groups that I am been doing is in the Twitter world. So many of person living with HIV that cannot totally tell their friends or families, they sometimes go to the Twitter and tell or voice out their feeling. And most of my blood brothers and sisters use Twitter to comfort one another. There are formal groups like Love Yourself, the Red Whistle, the Project Red Ribbon, that has, or some of the communities also have a different community groups that they can go to. And having this kind of support from these people is really empowering, especially for someone who is newly diagnosed.
Maybe, okay, the final question, maybe I should go back to Dr. Karl. Could you educate us again, especially those who may have been postponing getting tested? What happens when HIV is left untreated?
Well, what HIV does really is to attack the immune system. No, I like to explain to my patients that HIV will look for the soldiers in your blood. And when you keep HIV untreated, you run out of these soldiers, you run out of these cells that protect you from infection, and then you start getting sick. No? And these are called the opportunistic infections. Now, once you get tested and you're diagnosed to have HIV, you are started by your doctor on treatment, and the treatment, the antiretroviral therapy, will put the virus to sleep, no? So that it doesn't attack your immune system anymore. And actually, once you get to a point that's called viral viral suppression, or a condition being undetectable, you actually stop transmitting the virus. You're no longer contagious. No, and when the virus is completely asleep, your immune system starts to become healthy again, and you can get your life back, start living a normal life. So it's very important to get tested early, to get tested regularly, especially if you know that you engage in some behaviors that might lead to HIV. So get tested, get on treatment as soon as possible.
Yes, very important to get tested. Thank you for your insights. Infectious diseases specialist Dr. Karl Evans Henson and HIV advocate Lorenz Olleres. You can get more health tips on MedTalk Health Talk, hosted by Dr. Freddy Gomez, airing weekdays, 3:30 p.m.